Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer.
Hi, everyone. Welcome to Cracking Cancer. I am your host, Dr. Concannon. I'm a physician scientist and thoracic medical oncologist here at the University of Colorado. And today we're talking about does stress cause cancer and how does stress influence cancer treatment and cancer-related outcomes. Joining me are Ashley Holt and Erin Baurle. Maybe you both can take a moment to introduce yourself. We'll start with Ashley.
Hi, everyone. My name's Ashley. I was diagnosed with stage 1 non-small cell lung cancer in September of last year. I had a lobectomy in October, and I have been cancer-free since, being monitored with scans every 3 months. Previously had a health scare where we thought it might be reoccurring, and I'm actually currently in a waiting period, waiting on another blood test, which is pretty much my norm when you're on every 3 month scans.
So plenty of stress to go around.
Yes.
Yeah, absolutely. Well, I'm happy to be here. I'm Erin Baurle. I'm a clinical health psychologist here at the University of Colorado, and I oversee oncology counseling for our cancer patients here at the Cancer Center.
Awesome. And thanks so much for joining us, because I don't have to tell those listening or you, Ashley, how stress is so integral into the cancer experience, which treatments we select, where we go for our care. I mean, it's so integral. And I think your story was a really good one when you and I first met. This was one of the first things that we talked about, actually, was the relationship between stress and cancer. So I'm wondering, can you maybe kick us off by telling the audience what initial occurrence happened in your life that was a big stressful event that made you think maybe this is what caused my cancer?
Yeah, so I got divorced, like officially divorced in early 2024, I had to think what year we are in. And then a few months later, I got diagnosed with cancer. I have 2 little children. The decision to go through with the divorce was not one that was light. So I spent a year plus agonizing over if I was going to go through with the decision. And then also the just trauma that comes with separation and divorce and the decision. We're doing really well and co-parent well now. And our kids are doing well too, but there's a lot of unknowns when you make such a big change in your life, whether it's divorce, relocation, a new job, right? So this was like a big decision that I made that I didn't take lightly. And then a few months later, I found out I had lung cancer, which was another huge shock. And so when you're spiraling about how did I get a disease like lung cancer, especially when you previously thought that lung cancer was a disease for smokers. I've obviously learned a lot about it since then and understand the growing trends in younger people like myself. But initially, it was something that I worried about a lot.
Yeah. And what were you seeing out in the community, in social media, that made you kind of create this relationship of this stressful event and me being diagnosed with a cancer?
Well, first, just internally, like I have an anxious personality, and I also, I'm like a high achiever, perfectionist. I tend to like to have control over things. And so I think it's very natural when something like this happens that you try to figure out what you did wrong. Right? A perfectionist, someone who likes control. And what I've learned through my own therapy is that a lot of times the reason that you try to find the reason is because that makes you feel like you had control over it. And then even though that could be really scary, like, oh no, my divorce gave me cancer, like what a terrible decision I made. In a way, it provides you some sort of comfort as if I had any control over getting lung cancer at age 38. So that is like a huge thing that I've learned about myself and kind of knew about myself even before this diagnosis. But then, very well-intended, meaning people saying to me, do you think it was the trauma of your divorce? Or even at one point, someone saying to me, I read that the trauma that women go through can lead to it. And then they mentioned like maybe you're divorced. Very well-meaning people. And I found that a lot of people tried to find a reason, not just myself. And also a lot of people like to find silver linings, which is another podcast we could do. Because there is no silver lining to get cancer. So I think all of that. And then, you see all these stuff out there of like microplastics cause cancer. And like, so then you're like, oh my God, it's because I, store my food in plastic Tupperware containers or, it's like everything out there. I remember a podcaster that I love. She had an episode where she interviewed a physician about like what foods could help prevent cancer. And I couldn't even listen to it because I was like, I don't need any more ideas of what I didn't do right.
Well, and there's people saying everything,
Mhm.
everything.
There's some way to tie it back to cancer.
Yeah. And there's no burden of proof. Like for me, there's a burden of proof. I can't, because I'm an oncologist, I can't go out and say this causes cancer or this helps cancer. I can get sued. But if you're not an oncologist, you're just a random person. Like it's fine.
Yeah. Yeah. And I think it goes back to what Ashley has hit on so well is when we're diagnosed with cancer, the uncontrollability and what you're facing, we want so badly for it to be a simple answer or a simple solution or a simple way to prevent something bad like that from happening to us again or to our loved ones again. And it's easy to grab onto those ideas of microplastics or stress or trauma being tied into this really complex medical phenomenon that is an individual's tumor.
Yeah. Like something to blame, even if it's your fault, you have some understanding. But, a lot of this, as you know now, Ashley, is like, we don't know. And you can blame whatever you want. Stress is this, it's an easy thing to blame because we all have stress.
Yeah. It's part of being alive.
Yeah. So I'm curious, Ashley just went through her story of divorce, identified a lung lesion turned out to be cancer. And then there's this feeling of, guilt now on top of a cancer diagnosis of did this stressful event that I was somehow part of cause this? What's your sense hearing her story?
Yeah, pretty consistently, science continues to show us that stress in and of itself does not cause cancer. As you mentioned, we all experience stress. I'm sure you're going to experience stress today, or maybe even right now when you're listening to this. And that isn't going to lead to the development of cancer. And stress is really adaptive and developmentally helpful for us to have. And certainly we can have too much stress. But the fact, again, that is going to turn on some pathway and lead to cancer development is just not true.
Yeah. And Ashley, when you were interacting with these social media platforms or people who were trying to be helpful, I'm curious, what's the conversation like? Is it just the one-off, oh, I think your divorce did it? Or do people have more nuanced sentiments, I guess, around it?
I would say that most of the people in my life are super supportive. So like although I did have comments like that from some well-meaning people, I would say most of what I saw that continues to make me feel like maybe I did something wrong is more the social media that I'm exposed to. And then my own, the things I carry myself. But I just want to pause and just repeat what Erin said for everyone listening. Stress does not cause cancer. And that is a mantra that you should repeat to yourself whenever you're spiraling, because it has helped me so much to get an oncology psychiatrist who told me and actually sent me a research study on it. Because I'm like, anytime I feel like I want to go down that path of, it's probably all that dry shampoo I use. I don't know, like whatever is on my mind that day, I remind myself that there's no research to support these fears. And it's very comforting to know that, like the research says, stress specifically doesn't cause cancer.
Yeah, it's a great thing to grab onto. And I like that you called that out again. And it's just hard to believe sometimes because stress is so uncomfortable and it doesn't feel good. And we know that it can contribute to heart disease and we know that it can impact our immune system. And we're more likely to get the flu when we're feeling really stressed out. So it doesn't mean that it's not worth trying to manage your stress. But that idea, that causal relationship between stress and cancer is definitely one that we should let float away.
And that actually is something that helped me a lot too, that this idea that there actually are medical things that you can do to manage your stress. Obviously, therapy and meditation and all of those things I do as well, walks, but it took me getting cancer to go on medication for my anxiety. And it has helped so much. Like someone recently told me, you're such a laid back person. And I was like, oh, no one has ever said that about me. But I've been on Lexapro for a year and I really feel like it helps. And it's almost like my brain switched on how I thought about it. I used to think of it as, again, type A kind of perfectionist person is like a crutch that I would need. And now I think of it as like a tool that can help me, that provides literally wellness and mental health benefits and allows me to show up for my kids and myself so much better. So for anyone on the fence about that, like I would just, offer that thought to you to think about what taking an anti-anxiety med could possibly do to help you.
Yeah, Erin, can you speak to that a little more? I mean, you mentioned stress is necessary. It's adaptive. We all feel it. What are, I suppose, how should someone with cancer be thinking about stress in the context of their diagnosis?
Yeah, so one thing we do know from research is that improving your stress during your treatment is going to lead to better outcomes, primarily because people, when their stress is well managed during cancer treatment and into survivorship, however you define survivorship, leads to you being able to attend your appointments on time and consistently, follow the regimen that you need to follow at home, maintain your quality of life, take good care of yourself and your relationships. And all of that leads into just a better outcome package in terms of cancer.
Yeah, I think one thing that I learned in undergrad when I was learning how to navigate my own stress, which is, obviously not the same degree of stress that someone with a cancer diagnosis has. But the one axis I have in my mind a lot is you can think of productivity up here on your y-axis and stress on your x-axis. And if you have no stress at all in your life, you're probably not doing much. There's no, stress is a useful adaptive tool to implement change in one way or another. And it goes up. But once you get too stressed, you plateau back down because you're unable to navigate that strong fight or flight feeling. So you can't be productive. So I think what I see a lot for individuals who are in the cancer clinic and they're navigating their own stress associated with their diagnosis, their treatments, what can happen next, is there's a lot of anxiety, and that anxiety gets them to the appointment, and that can be good. If you had no stress about your cancer diagnosis whatsoever, that's not a good situation. Like, you need to engage and you need to get treatment. But if you're too stressed that people are doing all these things, or you are overwhelmed and you're not engaging, that can be a bad thing too. So it's tough because I think in our minds, we have this perception that stress is bad, and too much stress is definitely bad, but stress is necessary. And how you navigate that relationship is hard.
That's such a good point. I've never thought about it like that. And I really like that because that's how I've changed my view on anxiety. I remember when you telling someone that you were an anxious person came with like a stigma, or anxiety was something that you wouldn't want as a diagnosis on your chart. And now I don't feel that way at all. And I feel it's very normal to admit anxiety. So I made that transition already with that word, but I never thought about that. And if you're so right, if you had no stress about your cancer diagnosis, like you wouldn't seek out like good care probably, right? Or even try to get treatment.
We see that sometimes. I mean, truly, you see people who had a stage 1 something or other, and then they are, whatever, we'll see, it'll be fine. And then it grows. So that's a real phenomenon that I think anyone who treats cancer patients has seen at least a handful of times. But yeah, Erin, I'm curious. So you're someone who has really made a career out of helping people navigate the stress associated with their diagnoses. How do you counsel them on how to best manage their stress?
Yeah, well, of course, it's highly individualized on whatever the stressors are the person has been experiencing. But cancer, you were talking about silver linings before, and yes, certainly, I think that's a phrase that we need to to get rid of in some ways. But this concept that cancer rocks you on your heels and causes a bit of a life review in many ways. Like, am I doing the things I want to be doing? Am I in relationships with the people that are important to me, and I want to be spending my time in this direction? Cancer, no matter what stage, feels like a brush with death. And so there can be this really cool and meaningful personal growth and change for the people that are willing to take that critical look at the direction their life is heading and if they want to make changes. Certainly doesn't have to happen. I also work with a lot of people that feel like, I'm so mad cancer happened. I had everything going for me, and now it took me out of this path of my life that I really liked and had worked hard to get to. So looking at that, we'll certainly talk about your social relationships, your job, financial situation, which we know can be impacted by cancer. And then what kind of self-care activities do you engage in? Like endless benefits of exercise, sleeping well, eating well. And so trying to help people with those health behaviors often becomes a big part of our work.
Sure. And Ashley, what would you say has been the biggest detriment to your health and your well-being from the stress associated with your cancer?
I can never go back to not having had cancer. Like that's, yeah, it's, it stinks. Like you can never go back to your life before you had this diagnosis. And so whether your diagnosis is stage 1 or stage 4, like you have now had cancer. And so that's something that pops into my head every day around little things that I can dismiss. And then sometimes bigger things that, interrupt what I'm doing. And I'm only a year out from getting the diagnosis, a year and a little bit. So my hope is that won't always be a daily thing. But right now, when you're living in 3-month scans, I mean, I don't really know how you could not have
Yeah.
a daily reminder. So yeah, that's definitely it.
Yeah, there's a lot of loss with that, like loss of your identity, the way that you were looking at your future. It's a lot to sort through emotionally.
Yeah, and I still struggle with the term cancer survivor because like it's obviously if you get the diagnosis of cancer, that's the goal. But like at the end of the day, that's not a title I wanted, not at this age. So it's like some titles, you get titles sometimes that you didn't seek out for, right? Like I'm divorced as well. It's not a title I went into marriage wanting to have either. So it's just getting used to that title and getting used to this new kind of normal, I guess.
Yeah. Ashley, I'm curious for you, social support, especially at this stage since treatment. I tend to see that change a lot for people, and that the individuals who might usually be most supportive of you in other aspects of your life don't really know what or how to respond to you or what would be helpful, which can be stressful. So I'm wondering if you've noticed that or if that's come up.
Honestly, not really. So I'm pretty lucky in that regard. My sister is my best friend in rock, and she has just been like the biggest help to me. And so have my parents. And even, my ex-husband, with everything going on in our children. And I was in a unique situation because I got this diagnosis with very young kids that were just entering school. And so I was starting to meet people like, all of these like kindergartner friends. And it was really hard for me to attend some of those events after I was just getting a diagnosis because those people didn't know I had cancer. And even though, like I just said, the hardest thing is like having this new title, it's also really hard if someone doesn't know that you just went through that and you're trying to like make small talk with them about like, your kid's teacher or something. And you're like on a different planet, basically. So, definitely lucky in that the people that have always supported me were really there. No one that like was afraid they'd say the wrong thing so much that they stopped showing up, I guess.
Yeah. I mean, Erin, for the people that come into your clinic, how important is the social network to their ability to cope with the stress?
It's incredibly critical, I think, to successfully navigating a cancer experience. And that is a good area where research shows that we can help mitigate stress, and social connections are a really good buffer against the worst effects of stress. Um, and so sometimes as people transition away from what I define as like active treatment, like the surgery or radiation or chemotherapy, and they move into surveillance, the support system sometimes can be like, oh, you rang the bell, congratulations, you're done, and then move on with their life. And oftentimes that person is very much still facing psychologically, socially, and emotionally these ramifications from cancer. And so that can be stressful. That isolation might come up after active treatment in a way that it didn't when the casseroles were being brought and you had more medical appointments.
Yeah.
That's
Ashley,
how I feel.
yeah, I was going to ask, can you speak to that?
Oh, I mean, yeah, the amount of support that I got during the initial phase of like diagnosis and after my surgery was so like overwhelming and wonderful. And I honestly felt so loved. It's a feeling that like I don't want to let go of. Because kind of like what you were saying with um how some patients it's a review of your life, like that was part of the good thing that I got to review is how lucky I was to have these people in my life that were so supportive. But yeah, like I said, I'm constantly getting scans and blood tests and even though my parents get so mad at me sometimes when they find out that I went and got one and I didn't tell anyone, there's just this like, first of all, they come up. I'm like, I've got 2 kids. I'm like, doing parent pickup and I'm trying to work full time and do things like this and advocacy work. Right. And then I'm like, oh, I got a scan Wednesday. And so I go to the scan and I cry during the whole scan because I'm like PTSD and nerves and I'm back in this spot and all this stuff. But everyone's like, why didn't you ask me to come with you? And I'm like, I don't know. I didn't honestly think about it until I got in the car to drive there. So sometimes it's just, you feel like guilt asking, or you're trying so hard to forget that you have a scan 2 weeks from today, right? So you don't ask. So
yeah, I think that's really nicely stated and a really good example as well. Going back to this concept of stress and cancer and the intersection, like we're never going to get rid of stress. And so thinking that you need to get rid of stress in order to have good cancer outcomes or prevent cancer is unrealistic. And there's a lot of other ways that we can look at it because you have pickup and drop off and appointments, and that's always going to happen.
Yeah, that's helpful too. Like I'm never going to eliminate all my stress, right?
Yeah.
I think one thing that's come up repeatedly on our podcast is this feeling that in the beginning you have a lot of support, and then, and for you particularly, Ashley, because you had a curative resection, you're undergoing monitoring, hoping we've gotten all the disease out, but that you don't feel that when you're going, like you have to go to a scan and you have to be mentally prepared that this one's going to be positive and you got to think about what you're going to do about it. So you have to relive that every time, even though you don't have active cancer that we can see. So I think, and it's tough because it puts you in a hard position because all these people who are being treated for active cancer. Yeah. And that's a tough group to relay this concern to. So, I'm curious, how do you get your challenges heard from your community when they're perceived maybe a little bit differently?
I keep doing things like this, I guess, and talking about it. Yeah, I don't know. I really started to let go of the survivorship guilt that I used to carry. But it was very real for me until I had my reoccurrence. And then I was just like, nope, I'm not ever wasting another day feeling guilty that I got stage 1, because I also know that none of the people that I've met and interacted with metastatic disease want me to carry that guilt either. So anytime that guilt comes up on me, I replace it with gratitude, because it does. It still creeps up. But yeah, I think just talking about and being I don't know. It's a balance. I don't like to be a downer, but yeah, whenever I have a scan and I'm waiting that sometimes 2 weeks for the results to come back, I probably should text a few people that, hey, I wouldn't mind some check-ins or something like that because people want to help. So,
Yeah. And sometimes it's about directing them. Two things I wanted to call out from what you just said, which was really helpful. One is you use this metric that I'll sometimes work with people on in therapy of, is this a helpful or unhelpful thought? And that notion of what you said earlier, like, is me feeling survivorship guilt helping my friend that has metastatic disease? No. Okay, that's unhelpful. So can I use that as like my fulcrum or my turning point on thoughts I keep and thoughts I maybe let go or want to change or restructure? And so yeah, sometimes a very small practical tip, but I'll work with people on is, hey, we have the scan coming up. Do you have like a shared family calendar? Can you set a reminder on your closest inner circles phones or calendars that this is coming up, so it's not just you that knows? And can you give them 2 or 3 things that would be helpful? Like, do you want them at the appointment? Do you want them to bring dinner? Make some plans for that weekend so you're not sitting and waiting for the ding for your results to drop. I think though using calendars to our advantage can be helpful as well.
yeah, I should do that. That's a great idea. Because I do shared calendars for a lot of other things. So I can just put it on there and then I don't have to be responsible for saying something. It can just be there. I like that idea.
It's something I personally feel with my friends who have cancer, and Ashley, you're one of them, is when someone's going up to get their scan or get their blood test, something that's going to be an indicator of how things are going, I get a little worried that I'm going to trigger negative emotions by reaching out about it. Like, they're having a good time and I'm bringing this up again. I'm curious, Ashley, what's your interpretation when people reach out of the blue? Is it helpful, hurtful?
No, I love when people check in, but I actually always make a point to thank people when they check in and say, thank you for asking. Because it means so much to me that like I popped into their head and they thought about me. I mean, there are times though, like, because I do put stuff up on social media, like this last scan I had, it's like sometimes someone will ask me in the middle of like me doing something else where I actually had forgotten about it. And it's, it kind of stings a little, but like, I think the thought behind it, for me at least, is enough. But I'm sure everyone's an individual. I just had a dear friend who is experiencing loss in the form of miscarriage. And I felt the same thing. Like, I was like, I don't want to check in too much, So I just finally asked her, I said, are these check-ins helpful? Or are they too much? And she said, no, I really like them. And so that made it a lot easier for me to know it was okay to check in.
Yeah, I mean, that's good to hear, because I think a lot of people feel that. They care, they want to reach out, they are thinking about you, but they don't want to bring negative emotions to the forefront of your mind. If you're, trying to move on, you don't want to have the survivor's guilt, you want to spend time with your kids. And then all these reminders of the worst thing that's happened to you recently, like, keep popping up.
Yeah. And I do think consistently, while it might not always be perfectly timed, people do appreciate the outreach or the thought. And if you're someone that wants to outreach someone who might be waiting for a scan result, I think it's better to outreach and maybe ask less questions, but just that sentiment of, I'm thinking of you, or I'm sending good thoughts your way, or if you're a religious person, whatever feels right for your relationship with them, rather than asking for how's it going or when are you going to know, or some of those things that might set up stress.
Yeah, because I think a lot of people also want to help.
Yeah.
Which can be burdensome. So yeah, that it's a delicate dance, but I like hearing what are some positive ways to navigate that for the people who are listening and they have a loved one with cancer who's stressed out of their mind. And, those are things they want to do to help. And maybe that's a good transition point to say, Ashley, when you're at your most stressful points, what things were helpful from other people?
Just letting me talk, honestly. Like the people who just let me say all the things out loud. Sometimes when you say the things out loud, like me saying like sometimes I wear dry shampoo caused cancer. Like, I actually think that when I say it out loud, it sounds crazy and it makes me feel like better. I don't know. So, the people who let me talk and don't try to just give advice, that's so helpful. And then the people who do things without like really asking, like I don't know, just to, like the plan something for me and my kids or, um, like show. I had a friend, I was like, because again, I'm terrible at telling people, I was getting an MRI and she found out I was sitting at the hospital by myself and she's like, I'm coming. And she just showed up. And I was like, oh my God, it was so nice. I'll never forget that, So those are the really nice things.
Yeah, I think also ties back to something you said earlier with how stressful it can be to re-enter or encounter again the hospital environment and the doctor's appointments and the notifications on your phone. All of those things, especially potentially after active treatment is over, are so triggering and stressful.
Yeah, I actually turned the notifications off. So at least I have like a little more control over when I get the news. I mean, but I don't know when I'll ever get a phone call from my hospital without like feeling my heart drop. So, yeah, and those are the little things that like someone who has cancer or had cancer deals with all the time. And it would be nice to have someone check in or ask about those things.
Erin, what are some of the advice that you give to people about how they should manage their stress?
Mm-hmm. Well, good stress management program goes back to all those nuts and bolts. So again, like eating well, sleeping well is probably the best thing you can do for your health. And at some point, we'll do a conversation around sleep and cancer and that intersection, because it can be really hard to sleep with many cancer treatments. And then certainly if we're scanning you every 3 months, you're going to be stressed. And so your sleep's going to be impacted by those things as well. Looking at your relationships and what maybe we want to let go of and where we want to invest a little bit more time with people can be a really helpful stress management technique. Exercise is critical. What we know is that when we stress our body out with exercise, we get better at then responding to stress when it pops up in the real world, which is part of why exercise can be so helpful to us, as well as the meditative component of exercise. Formal stress management practices can be helpful. Not everyone is going to meditate, and that's okay. One simple technique you all can practice today is called the Stoplight Meditation. So the next time you're at a stoplight, instead of grabbing for your phone or adjusting the dial, can you just sit and breathe? Just breathe in through your nose and out through your mouth. That's it. That's the whole exercise. And those little moments of peace that we can get throughout our day can be really helpful and then also help strengthen our relaxation response for times that we're stressed. So if we practice relaxation in micro doses throughout the day or maybe a more formal practice, when stress does come, because it will, we're able to tap into our reversal strategies in our body a little more easily.
Yeah, that's a great point. It's interesting because we think of I guess we think of neural pathways as being, fight or flight, or I react this way, or, I'm doing this because X, but I think of it a lot similarly like a muscle.
Mm-hmm.
You can practice a response to a stimulus. You can practice at the stoplight, low sensory input, maintaining good breathing. And that neural circuit is it'll actually physiologically change to be more easily accessible. It's like you can think of wiring, and if wiring has more insulation around it, that signal travels faster. Those kinds of things can actually happen in the brain. So you can rewire your neural circuitry, is at least my understanding.
Yeah, exactly. The two analogies I'll use sometimes similar to that. One are, if we want noticeable biceps, we're going to have to do a lot of bicep curls. So if we want a strong relaxation response, we're going to have to practice the relaxation response. We can't try and tap into that for the first time when we're waiting for test results. And similarly, sometimes I think of the neural pathways in our brain like roads. And so if the relaxation response is a bit of a like country road for you, we want to try and turn it into, we're here in Colorado, so like I-70 or like a super highway that gets traveled a lot more frequently and your brain can get onto it pretty quickly.
I won't use that analogy for Houston, where I came from, of 610, because anyone who's been on 610 knows that it's not a stress-free place to live. It's the
I
most
was
stressful.
thinking about the stoplight analogy because I used to live in Chicago. I was like, if Chicago drivers could all practice the stoplight therapy, the meditation, we would be much happier drivers.
Well, and it's interesting, we're talking about ways to navigate emotional stress, which is, I think, what most people think of when they think of stress. But a lot of times when I have a scientist background, and when people are modeling stress, they're not only modeling emotional stress. Like we model physiologic stress, cortisol responses, adrenergic responses, fight or flight. That's usually what we're modeling. And it's actually hard in our everyday vernacular, like how we talk. We don't really differentiate those really well. A lot of times we're talking about emotional stress, but I'll say from the medical standpoint, a lot of times when we say stress, we often mean physiologic stress. Your body is undergoing some sort of damage, and cortisol is a response to increased blood pressure and things like that, like to make sure you don't go into shock. So the term stress is actually vaguely used across different contexts. And I think sometimes when we hear about data from the laboratory or some other study that says stress is associated with this, we assume that means emotional stress. And that is not how it's always used. So I think that also feeds into some of the misconceptions about how stress influences even the immune system and things like that. Because a lot of our models are based on physiologic stress, which has really high cortisol levels and things like that because you're trying to survive. And that may not always be the case with emotional stress. So it's hard to always tease those apart. But that's why in this realm and other realms where we're talking about what does or doesn't cause cancer, what does or doesn't influence treatments, we have to be really careful about the conclusions we make. Because it's really easy to look at something from a piece of data in the lab and then spread this out through making incorrect assumptions. And people can quote studies and they can quote doctors and it sounds really official. But the reality is a lot of times the conclusions are wrong. You can't make those conclusions. And part of me thinks that's where this assumption came in the first place, that stress causes cancer, that stress worsens cancer. We don't have any real data to suggest that that's true, but I can see where someone got there. I think it's from misinterpreting studies in the laboratory and things like that, completely out of context.
Yeah. I think that's really nicely stated and important to keep in mind as a non-scientist. Another interesting thing about stress is we have actually found that choosing between two good outcomes, which is called eustress or EU stress, is the most stressful kind of stress because we always want to maximize our benefits. And so people think of stress as this awful, terrible thing. But if you take your kid to the ice cream store and they can only choose two things and they really want three, that's a really high degree of stress that they're facing. And so it can just be kind of fun and important to call out that not all stress is bad stress. And if you're choosing between two good things, that is a real form of challenge.
Well, and two follow-ups to that. One, as a native Vermonter and supporter of Ben & Jerry's ice cream, that is the area of the grocery store where my wife and I spend the most amount of time, is just staring at that is a very apt analogy for myself and my family is like, do we want Cherry Garcia or fish food? And then we look at, and then now they have the ones with the core in the middle, and now they have, chunks added. And it's like, for any of those options, it'd be fine, but, for the rare person listening who isn't listening based on ice cream recommendations in cancer care, that is insanely critical. I mean, a lot of times people see us, here for second opinions. You'll go to third opinions. Actually, I know you've had multiple opinions in different areas. And generally speaking, this is an area where reasonable minds may differ. You can have 2, 3 reasonably good options, and none of us can tell you with certainty that one is better than the other. Mm-hmm. So it is the ice cream analogy, but to the person who's going through it, it feels like this could be the make or break of whether you live or die.
Yeah.
Yeah, I've definitely felt that. And then I've had the end thought of, why did I put myself through this? Why did I ask for more scans with leading to more waiting? Because that's what I ended up doing. So my first physician recommended 6-month scans, and not to follow up with an oncologist. I went to an oncologist. Then I got a second opinion, and they recommended every 3-month scans for the first 2 years, just because reoccurrence is highest in those first couple of years. So I signed up for additional scans, and I really haven't said no to anything additional yet, because just like Kyle said, it's very hard when you feel like it could be something that you'd find earlier to say no to. But I definitely, when I went through the scare of the reoccurrence, had doubts of, was that the right choice for me?
Yeah, one thing I heard from a community practice colleague who treats multiple different types of cancer, who's been at this for longer than I have, he had this analogy with a patient who came in and they really wanted chemotherapy right away. They were waiting for molecular testing, which would inform what we do, but they have this cancer in them right now and they don't want to wait, So the way he counseled that was saying, right now your cancer isn't a medical emergency, but I appreciate that it's an emotional emergency. So like that decision to wait versus let me just go find someone who's going to do something is a really, really hard decision to make. And I think right now we're in an area in this field where people have access to do more and more and more things. And that gives us a sense of control, and it gives us, I don't even know if it alleviates anxiety. But I do know it's not always good.
Yeah, right. Doing something feels good, but it isn't always the right answer, especially in the context of cancer. Like, it's really hard to recognize that waiting for results or waiting on whatever it is that's been recommended is potentially the right step for you. And I think that goes back to an anxiety reduction technique we'll talk about a lot, is having trust in your treatment team and making sure you do have that relationship with them. And also this concept of, in some ways, kind of being the CEO of your own healthcare. That doesn't mean that Kyle's opinion isn't important. It's just that he and maybe other opinions you have and what you know about your body come together, and you're the one that ultimately has to make the decisions and feel good with those decisions at night. Which can be just a really helpful way to mitigate a lot of stress in the cancer process.
Yeah, and I think you have to also take breaks and give yourself grace. Like, the reason there's not always a clear-cut answer is because there's just not the research there that supports it, or evidence. I think Kyle's the one who kept calling it with me like a gray zone. Is that right? Evidence-free zone. That's what you said.
Yeah, that's usually the term I use.
Yeah, an evidence-free zone. So a lot of times you're making decisions when there really is no evidence, and that can feel really daunting. Like, you could make the wrong one. Evidence someday might show up and say that, right? But you can only work with what you have. So just giving yourself grace. I mean, especially too, if you immerse yourself in these sorts of things, like podcasts, community, like, it's okay to take a break and just, get back to regular programming. Because, we all need that. So that's something that I've learned. I went in so strong wanting to advocate for lung cancer because I truly didn't know you could even get it until I got it. And then I realized that I needed to take breaks. And then I also had a reoccurrence, I thought, happening, and then I wanted to dive right back in. So, it's okay. It's a wave.
And those boundaries are a really critical way to maintain your stress as well. It's not only boundaries with, like, maybe this part of your identity, but also your activities or people that you're interacting with, and recognizing, again, using that turning point of, is this helpful right now or is it not helpful? And there might be times where pulling back is really what's best to manage your stress.
Yeah, and I'm happy you mentioned that, because I think a lot of people who are probably listening to this podcast are doing so because they're trying to get as much information and they're trying to prepare themselves as well they can for their cancer journey or their loved one's cancer journey. And it's hard to know how to toggle those switches, like, more information is usually good, but when it overwhelms you and that ends up being your whole life and that causes stress, and all of a sudden your relationship with your kids is being influenced because you're stressed all the time from the cancer stuff, like, is that the best outcome? Probably not. So it's really hard to navigate that and identify when to put up those boundaries. Is that something you can speak to? What are some red flags that people can look for as to when they should seek help, reassess how they're addressing their cancer care?
Yeah, we look at exactly what you're talking about, is that impact on social activities and your everyday activities. So if your performance at work is starting to suffer because you're on Google all the time looking things up for your cancer or a potential new trial or something you could participate in, or if you notice your social network, it's not feeling like a two-way street, of course, that's going to be impacted by cancer. And so it might not look the same. But if you're really starting to notice those relationships are suffering, you're having trouble sleeping, you're ruminating, or just kind of on a cognitive loop with whatever's going on, it's probably a good sign that it's time to take a break. And therapy, of course, can be very helpful. One thing that we like to do is challenge and try and figure out, like, what data is it that you're looking for? And if you dig deep enough, the person usually says, like, well, I just want to know that I'm going to make it or that it's going to be okay. And then we have the challenge of sitting with the fact that we don't know that. Like, there are things we can do that are within our control. And how can we take the best care of ourselves and have the trust and the best treatment team for us? And then how do we accept that other half, that we don't know what the future is going to hold for us? And that's hard.
Yeah, it's very hard being on the patient side of it. And I definitely haven't figured out like a gold star solution. So I'm just navigating it here with everyone else and doing the best I can, honestly.
Yeah, it certainly sounds like it. I'm glad that you have this great support in place. And it sounds like a place where you can sit down and ask these big questions and sit in some of the discomfort that comes up.
Yeah, sitting in discomfort is a tool that I would say, have started to use later, more recently, and it's been very helpful. Mostly because it's just teaching myself more about myself and how quickly I want to get out of the discomfort. Um, it's very interesting because after reading and the therapy that I've done, I definitely understand more why, if you can just sit in that discomfort and feel it, it's actually easier to let it go than trying to fill it. Like, there's benefits to both. There are times where I just need to take a walk. I need to talk to a friend. I need to change it because I've got to be a mom right now, or I've got, a big project at work or something. And there are also times where I could absolutely just sit down and let myself cry, feel sorry for myself, whatever. And I push it away and start to try to do something like laundry or cook or whatever. And now I'm trying to be better about just sitting there and letting myself feel all the fears. And it's scary. And then they go away. It's like, it's so cool when you just stop fighting it so much.
That's really powerful. Thanks for sharing that. I don't know if this resonates at all with you, but sometimes the way I'll describe it is it's, a bit like a wave, right? And we like to back away right as the wave is about to crest. But if we sit there and let it crest, it sucks, but it does feel better on the other side.
That's exactly how it's felt for me. I'm still learning to really do it because I'm such a action person, doer, that it really is uncomfortable and against how I usually have lived. And now, as I have learned more about it, I wish I would have known this earlier. That, and I wish I would have started an anti-anxiety earlier.
Lexapro is like the best.
Yeah.
Brought to you by.
Yeah.
No,
I know.
They're not our sponsor. At least.
Whatever medication works for you.
No, I mean, I love how you mentioned the sitting in the discomfort, because we have these sentiments of exposure therapy for a lot of things. And I haven't actually framed in my mind exposure therapy for the discomfort associated with the cancer diagnosis, because I think of coping as being doing something else, and it's kind of like you're afraid of spiders. Rightfully so. They can bite you. They're a reasonable thing to be afraid of, but your closet's full of them and you need to do something about it. And it's like my addressing the topic is the de-stress, and that does make the feelings go away, but you always know you have the spider in the closet. And this kind of seems like sitting with those uncomfortable emotions that, no, this really can come back. No, this really can progress. The next treatment might not work. And sitting with that for longer, letting that wave go over you, is dealing with the closet full of spiders. Yeah. And, I haven't thought of it that way, but for me and maybe my future counseling for my patients, it's a really helpful way to frame it.
Yeah, one thing that we know is it feels really good to avoid a feeling in the short term. It works really well. You immediately feel better. However, long term, it always comes back and it tends to come back stronger. And so in that case, I'll use the analogy of a boomerang. Like, sure, you got rid of it, but it's coming back and it's going to catch you at a time where you might not expect it the next time. And it's going to be harder to process through because you're kind of, there's a lot of it built up. So yeah, building that tolerance for sitting through the discomfort, shining a light at what I call the monster under the bed. So like our worst fears or our worst case scenarios. I don't want you to live there, but sometimes just going there temporarily or putting your toe in that water can help reduce overall distress.
And sometimes you realize you know exactly what you would do. If you just like let yourself sit in it, you're like, okay, I'm going to do this then. And then all of a sudden, this thing that you wouldn't let yourself think long enough about, you realize, okay, I'll figure it out. I already have an idea of what I might do. Even if it's not obviously a thing you don't want to happen, you still a lot of times have some sort of solution.
Yeah. There's some cool data. I'm not sure if it's been published yet from one of our colleagues in my field. And this has to do with patients who have cancer that isn't curable and they're worried about death. And they were instructed to write about their worst case scenarios when it came to their death for 30 minutes. Of course, it was really, really, really hard. But their distress, not only immediately afterwards, but then also months afterwards, was significantly less than those that kept just trying to push some of those thoughts away. So again, super uncomfortable exercise, but we're starting to understand more and more scientifically that exposing yourself to those thoughts and being able to work through them, which I think therapy is a really good place to do that, can have really good benefits.
That makes a lot of sense.
I'll say as a provider, that's one of the most challenging things that I have with patients is we all die, everyone. But it's hard when that's a kind of acute concern. Like that can happen now. This is the thing that might end up ending your life. And I'm the doctor they see to talk about that thing. Many people have had other health issues, but rarely is it saying an overwhelming statistical probability is that this is going to be the thing to end your life. So coping with the sense that life is, final and that might be coming soon is not, it's hard for me to counsel the patients on. And I struggle with it, like I've had patients die in the last week and it's hard. It's really, really hard as a provider to also acknowledge that finality of a relationship. So I'm curious, and maybe without letting the anxiety around that spiral to the point where it's debilitating, at what point should a patient seek help, or even a loved one of a patient who's coping with that loss, when should they seek help and see your colleagues?
Yeah, good news about mental health is that we know the same thing applies to us as to medical intervention and care. So the earlier you see us, the better. And there's probably a lot we can do earlier. And it's certainly further along in the process as well. So I say that just to say that there's almost never a bad referral to us or our team at any point from diagnosis into whatever phase you're at after or during active treatment or approaching end of life. And same for the caregiver. Just like a brief outline of psychosocial oncology is the newly diagnosed period is high stress, high intensity of feelings. We don't know what's going on, but we know something is wrong. Then active treatment starts. There's a little bit of calming down. Caregivers tend to suffer the most during this time because they're picking up all the stuff around the house and different social responsibilities while the patient tends not to feel well or is recovering. And then there's that ring the bell. Caregiver kind of goes back up to baseline, and then the individual who had cancer tends to suffer it themselves. So that's kind of a brief gamut, and certainly in what we call metavivorship or individuals with metastatic disease, I don't think there's ever a wrong time. So if you're thinking about it, I would say ask for an appointment, and we'd be happy to talk with you and see if we could be a fit.
Well, one thing that you just touched on that I would love to highlight is ring the bell, and then the patient is the person who experiences more discomfort. I personally I don't like the ring the bell. I'm a little bit vocal about that because of exactly what you're describing. It's not over.
Yeah.
You're still getting scans. You're getting scans because people progress. So I think this is just my pitch to you to say, what do you think about ring the bell?
I always like to prepare people for it. So it's a big thing I'll talk with people about if we're working together during active treatment, or even for those folks that are going to be on treatment the rest of their life. Often they'll be offered an option to ring the bell in between treatment transitions. And so we'll have a conversation like, is this what you want? Do you want it to be recorded? I've had people show up in dresses that you wear to like prom. I've had people have parties, and I've also had people say like, I want no memory of this. This means nothing to me. I just want to move on with my life. So I think whatever intentionality you have and relationship you have with it is important, and then to communicate that to your support system. So I guess I like it as an option.
Yeah. And I think I don't want to deprive people of the positive sentiment around it. I think it just has to be appropriately articulated that this doesn't mean it's over. Because I think a lot of times, a lot of people ring that bell and they think they're done.
And then,
And it's really hard to pull them back.
I never even rang a bell. I mean, no one offered it to me, like, to be honest, because I had a lobectomy and was discharged. And I mean, so my experience with the cancer was so brief. So it's interesting. I've never thought about it really until now, but it's probably one of the reasons too, like sometimes I have trouble with this term of like cancer survivor. Even though like I've had plenty of stress, despite only needing a lobectomy, and just life changes too, right? Like little things, like I still wheeze a little and, notice, and I have the incisions and all of that. But yeah, I mean, I definitely don't like things that make you feel, I guess, like not a part of a community. Like, I don't know. But I will say that the whole I get really frustrated that the patient has to call and ask for the appointment with the oncology psychiatrist. Like, this is something I've talked to my oncology psychiatrist about. Like, I don't understand. Like, I literally get a diagnosis of cancer and then they hand me a folder. And I mean, obviously I have my care somewhere else than where you guys work, so I don't know how it is in Colorado, but I got this folder with all these resources, but it was put on me to initiate any of these resources. But within days, I had multiple calls from the hospital to schedule my lab work, to schedule, like I had to get this oxygen testing done, some sort of, I totally butchered whatever I had to get some sort of test on my breathing. I had to get, the lobectomy scheduled. I had nurses calling me about my surgery, but it was me. I had to call and schedule with an oncology psychiatrist. And I just wish that the medical community would rethink that and everyone would get a call to schedule their appointment with a psychologist or psychiatrist or whatever, because I just can't imagine you not benefiting or needing to talk to someone after getting such a life-changing diagnosis.
Yeah, I think that's really nicely said. And I wonder if one day we will get there. And I think where we're trying to work right now is to work really well with our medical colleagues on recognizing and normalizing access to mental health care and having the referral come from them. But in figuring out what is the appropriate point, and does that look different from lung cancer versus ovarian cancer? There's a lot of research being done on that front, but I appreciate your advocacy around how important it's been and helpful it's been for you, and that at any point it makes a difference, and we should start as early as possible.
Yeah, I know not everyone will want it, but I just wish it was made easier to access, I guess, because anything that gets put back on the patient to organize and schedule is just another burden, I feel like.
Well, in our last moments here, Ashley, any other words of wisdoms or questions to Erin here before we cut loose?
I mean, the only thing I want to reiterate is your stress and trauma did not cause your cancer. And so that's your mantra. It's mine. And I hope this podcast helps anyone who spirals and thinks that, because I mean, this has been like therapy for me. So thank you, Erin. It's like I got another session.
The bill's in the mail. No for your eyes.
It was so great to meet you and learn a little bit more about you and your experiences. And I'm sure others are going to benefit from hearing about it.
Thank you for all you do for us, because mental health is just as important as the other treatments that we get. So I really appreciate getting to know you.
Couldn't agree more. And Erin, any last sentiments for our listeners?
No, I agree. Your stress didn't cause your cancer, and there's a lot we can do on the stress management side of things. It's still worthwhile to invest in your quality of life and figuring out what ways you can manage your own stress.
Yeah. And I would echo that, in medical oncology and surgical radiation oncology, we work really hard to help people live longer, but living longer only matters if you're able to enjoy that time. So, appropriately addressing mental health concerns, critically important as anything else we do. And with that, we'll cut it loose. Thank you, Erin, so much for joining. Ashley, thank you for joining. Everyone, this has been Cracking Cancer. You can subscribe, and go to crackingcancer.org for more information. And we will see you next time.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.